Hey, this is a little overview, quick one of the appendicular skeleton to help you guys out a little bit, hopefully. So we have the clavicle, sternal end, acromial end. The conoid tubercle is on the inferior surface right there. We have the acromion, which is an extension of the spine of the scapula itself, supraspinous fossa, infraspinous fossa, the glenoid fossa, coracoid process. We have the humerus here, with the head of the humerus that fits into the glenoid fossa. We have the greater tubercle, lesser tubercle there, the bicipital groove there for the biceps tendon. We go down to the distal end of the humerus, and we have the capitulum, trochlea. We have the coronoid fossa, with the coronoid process of the ulna, and then we have the olecranon and the olecranon fossa, or olecranal fossa. So the humerus, we have the trochlear notch here that fits around the trochlea. We have the head of the radius that articulates with the capitulum. We have the radial tuberosity. It's this bump that protrudes off the anterior surface. We have this ski slope anterior, nice flat surface here, so that shows you what's anterior on the radius. Then we get down to the styloid process of the radius and the styloid process of the ulna right there. And then we also have where the head of the radius fits into the ulna here. We have the radial notch, and where the radius fits into, or the ulna fits in the radius together at the distal end. So we have the ulnar notch, of the radius. If I can get them apart, I can't. So it's right there. So then we have the carpals. So we always start from the thumb side. We're talking about these. So we have Sam likes to push the toy car hard. So we have Sam scaphoid likes lunate T or 2 triquetrum, push pisiform the toy car hard. So the trapezium, and then we have trapezoid, capitate, and hemate, which has the hook on it there. Then we have those are the carpals. Then we have the metacarpals. We have metacarpal 1, 2, 3, 4, 5. That's all in the palm of your hand. And then we have the phalanges. The thumb, we have the proximal and the distal phalange, only 2 phalanges in the thumb. All the other digits have 3 phalanges, and we have the proximal, middle, and distal for digit 2. This is proximal, middle, distal for digit 3, proximal, middle, distal for digit 4, and proximal, middle, distal for digit 5. Okay, so that's the upper limb and pectoral girdle. Then the pelvic girdle, we have the pelvic bones, so we have the right and left pelvic bones. The pelvic bones each consist of 3 bones. So we have the ilium, and then the ischium back here, ilium, ischium back here, and then the pubis here. And then we also have the obturator foramen here, and we also have the acetabulum, which is your hip socket. So the head of the femur fits into the acetabulum here. So we have and also we have the sciatic notch here. So the sciatic nerve comes through here, comes out of the sacral lumbar area and runs down the posterior part of the thigh back down here. So we have the head of the femur, we have the neck of the femur, we have the greater trochanter on the lateral side, the medial on the medial side, we have the lesser trochanter, and then we come down to the distal end of the femur, and we have the condyles. So we have the medial We have the medial condyle here, and the lateral condyle here. And then we have the patella on the anterior surface of the femur. And then we have the leg, we have the tibia here, and we have the tibial plateau. So these are condyles of the tibia here, with the medial and the lateral condyles of the tibia. Collectively, we call it the tibial plateau. This bump here in front, right there on the anterior surface, is the tibial tuberosity. And then at the end of when you extend out the tibia and you go down towards the ankle, you have the end of the tibia. There's the medial malleolus. This is always medial, and it's always on the big toe side. Then you have on this, and that's or sometimes called the tuba, to just help you remember that one's bigger than the fibula, which is here, and that's the flute. So we have the head of the fibula, and since we have a medial malleolus right there, we have a lateral malleolus right there on the fibula. And then we come down here to the foot, and so we have the ankle. These are the tarsals, and we have the talus, we have the calcaneus, and then we have, this is the navicular, and then we have the medial, intermediate, lateral, cuneiforms, cuboid, and then we have the metatarsals, 1, 2, 3, 4, and 5, and then we have the phalanges, and just like in the thumb, which is the pollex, we have the big toe, which is the hallux, and it has a proximal and distal phalange only, and then the other 4 digits have proximal, middle, distal. That's for digit 2, proximal, middle, distal for digit 3, proximal, middle, distal for digit 4, and proximal, middle, distal for digit 5. And the big toe is always digit 1, and the thumb is always digit 1. So there you go. There you have it. There's the appendicular skeleton in 7.5 minutes. Bye.